chatting with Congresswoman Kendra Horn, joining us via Skype. I was going to say good morning. It's in the afternoon. Good afternoon, Congresswoman.
Good afternoon. It's good to be with you this afternoon.
It's good to be with you too. I know you're making the media rounds. I saw some of your appearances earlier this morning. Lots to chat with you about, including, I understand you are quarantined, so let's start right there. How are you?
I'm fine. Still currently no symptoms. I feel good, but making sure that we're following the best advice of the house attending physician and other doctors. That I was exposed to a colleague who has tested positive for COVID-19. So this is important precautionary measure to make sure that I don't take a chance of exposing anyone else. And that's really why it's so important for us to take these distancing measures now to make sure that we're protecting ourselves, our friends, and our neighbors to help flatten this curve for this dangerous virus.
Life has changed a lot for us, hasn't it? You're doing a lot of interviews there. You have a remote setup. I've got a remote setup here at my place. You may see a cat bouncing around before long. You know, some of the interviews you see on national networks, there's kids in the background. Life is different, isn't it?
It really is, and it's amazing how fast it's changed, and how much it continues to change on a day-by-day basis. I think that's one of the things that we know from a policy standpoint, Congress at the federal level, we have to continue to adjust and take action. But certainly on a day-to-day basis, our lives have changed. I'll be in my house until the 28th at least, and hopefully we'll be here without incident, fingers crossed. But in the meantime, we know that this is impacting the health and economic well-being of people all across Oklahoma and the country. And there's just a lot of uncertainty, and that's why we have to stay focused on taking action to help our communities.
Let's pull on that thread a little bit more. What are you hearing from your constituents, the people back in Oklahoma? What are the needs that they're saying, hey, Congresswoman, X, Y, and Z?
Well, let's start with one of the most obvious, and that's healthcare and testing. I am still incredibly concerned at the lack of testing that's been available, and am continuing to work with health professionals in the state because the testing kits are not coming as quickly as they should. We're talking to hospitals and healthcare professionals who are quickly running out of their personal protective equipment. We need these resources desperately, and because this has grown so quickly, the needs are outstripping the supplies, and so that's why a couple of weeks ago we passed the $8.3 billion funding package to get more money into our healthcare system. But we are still experiencing a shortage of supplies, and we have to address that. And then looking forward, what we're going to do to make sure that we're again reducing the number of people who are likely exposed, because our healthcare system is going to be and is rapidly becoming overburdened, and we're very concerned about that. And that's just the healthcare, right? And that we also have significant concerns and fears and uncertainty from families with kids, small business owners, individuals whose jobs are uncertain, and we have a lot more work to do. So we've passed 2 bills so far that have been signed into law intended to address this, but we've got a lot more work to do. The first, of course, was that funding package for research, for getting money into the healthcare systems, especially our public health system, and testing, and support for food, especially for families and children who are relying on or have relied on school breakfast and lunch programs that are food insecure. We have to make sure they can continue to get the food they need, because these are programs that our families and communities have relied on. And then the Families First coronavirus response bill that the House passed just over a week ago now, and the Senate passed a couple of days ago. Strongly bipartisan package that includes support for families and individuals. It includes 2 weeks of paid sick leave, 2 weeks of family leave, and up to 10 weeks more of paid parental leave, as well as increased supports for our unemployment system and food supports, as well as ensuring that everybody that needs a test can get it paid for. Now, the other side of that is we got to make sure the tests get here, and that is still a challenge. And the next step is, how do we help make sure that we're taking care of our businesses. And so we're working on the third package right now that will have a lot more economic impact for our businesses and business owners and affected industries, as well as families.
You mentioned the testing. I saw a release today from the State Health Department in Oklahoma of a partnership with private test companies, I believe is what I was seeing there. Is that another direction, another perhaps solution?
I think we need to be exploring all potential solutions right now, and hopeful that comes to fruition. I know that to this point, the State Health Department has been severely limited. They've requested tests and more resources from the strategic stockpile of the personal protective equipment. But as of a couple of days ago, their supplies of tests were running very low, as well as the swabs needed to conduct the test, and the medium needed to transport and test. And we've got a lot of work to do, because the State Health Department has really been the only place in Oklahoma so far that's able to test. So we've got to get more supplies and more labs that can do the test, because right now we know that the numbers of people who have tested positive have increased dramatically. We've seen our first fatality here, but what we don't know is the extent, because the tests are so limited. And that's why it is urgent that we get the supplies in as soon as possible.
You mentioned some of the work you're doing there is seeing bipartisan support. Can you kind of take us behind the curtains here? Is that mostly the case, or is there some politics as usual going on? How hard is it to get agreement?
Well, it's a combination, right? The first package that we passed, the $8.3 billion in funding, that moved pretty quickly, strong bipartisan support, and tackled that first phase of the problem. We still need the administration and Human Services and CDC and all of the other federal organizations to really work together to get these supplies out, and that's something we have to continue to hold them accountable to, because we've got to make sure that people in our communities get the support they need. The second coronavirus response bill, the Families First package, it passed the House with strong bipartisan support, and the Senate as well. It was only 40 votes against it in the House, 8 votes against it in the Senate. That is a strong vote of bipartisan support. It was not a perfect bill, but we had to move quickly, and it is definitely an important step forward. I think there's a lot of different ideas and questions about how we approach this next step, because we're in uncertain territory. Unlike the financial crisis of 2008-9, this is not a crisis of market confidence, but it is creating a financial crisis, because we're having to close businesses and schools and so many other places to protect the health and safety of our communities. And at the same time, we have a pandemic on our hands that is impacting health. So the way we have to respond is by tackling it from all different sides. We need health support. We need help for families and individuals and small businesses. And I think for me, one of the things that I'm noticing is that everybody is really the people that I'm working with, being incredibly thoughtful and intentional about, okay, how do we do this? Now, we don't all agree, but that means we've got to keep working to get the best possible package together. And one of the things that I'm going to continue to focus on is healthcare, access to care, including mental health services, but also fighting for small businesses, making sure they get the access to capital so they can keep their employees on the payroll. Those are the kind of things that we're talking about, so we don't lose those jobs. But without income coming in, it's really difficult for the small businesses to keep their employees. So that's where our jobs have to come in, is making sure that we're dealing with that, and then figuring out how we plug in all of these other things that are important to our communities.
Chatting with U.S. Representative Kendra Horn, who is nice enough to give us a few minutes here. You mentioned communities and businesses. So when you walk through a Midtown or Paseo or Uptown here in Oklahoma City, or anywhere in the state for that matter, sure, you see restaurants, you see businesses that are not in operation right now. I guess my question to you is this: any sort of timeline of when they might see some support?
I don't think I can give you a timeline. I'm not sure that anybody can right now. And and we've got to all be honest, this is hard on everyone. It is, it is scary, it is uncertain, and that's why it is all the more important for us to come together, because COVID-19 doesn't care who you are, what state you live in, what your politics are. It doesn't discriminate. But what we do have to do is remember we're all in this together. And the quicker we take action, I know it is hard to distance ourselves from each other, to have children out of school. This is creating a whole other level of challenges, to have our restaurants be only takeout or pickup and delivery. But the reason it's important is because unless we all come together, the consequences are grave. But what I can say is that I have been working hard from my house, but thankfully we have technology that we can continue our work on calls, working with my colleagues, reaching across the aisle, working with other elected officials, community leaders, business leaders, to understand their particular challenges. And we are listening and actively advocating for policies that will be included in this next package that will help Oklahomans to weather this storm so we can come out on the other side stronger. And we have to remember we're all in this together. And I will do everything I can to make sure that we are getting the answers and the information out as best we know it on a regular basis, as well as communicating with the experts in the healthcare field so we can communicate the best and most accurate information, as well as making sure that we at the federal government level are providing the resources needed so that our businesses and our base of commerce can be ready to take back off when we're on the other side of this.
I was looking around at my notes. I know you have a town hall, a telephone town hall coming up this Sunday at 5 p.m.
Yes.
How can people, I'll give them the logistics of how they can participate, but what are you looking to get out of that?
So, as you may know, I've had a lot of town halls and was named one of the most accessible members of Congress. And right now, that means we have to do it a little differently. We can't do it face to face right now for our health and safety. So this Sunday afternoon's telephone town hall, and we've got the information if anybody wants to participate, will be myself and a number of experts in the medical field, healthcare experts, and we're going to give updates about our progress on this next response package, the economic stimulus package, where we are and how things are moving. And the healthcare experts are going to be talking about where things stand as they know it. And we're going to open the line up to make sure that people have the ability to ask questions, express their concerns, as we would in a face-to-face town hall. We're also working to make sure that we had a roundtable with other healthcare experts last Friday that we put on Facebook Live. We're going to do everything we can to get the information out. That's why I've been talking to the media so much. There's a lot of misinformation out there. There's a lot of uncertainty and fear, and it's understandable. But we're going to try to make sure that people have the chance to ask questions and that we have the experts, because I'm not an epidemiologist or a public health expert. So I want to rely on them to get the best information out that we can.
Hey, final question for you, kind of on a personal level. As you interact, as much as any of us are interacting these days with just ground level people in our lives, what are you hearing from people?
I'm hearing a lot of questions. I'm hearing a lot of uncertainty. I'm hearing a lot of wondering what the policies are going to look like and how we're going to respond to our communities, and there's also questions of why this social distancing is necessary. Is this disease really as serious as some people have heard? And the answer to that is yes. We have seen tens of thousands of deaths worldwide, and it's only exponentially growing. And we have to listen to the best health and safety advice, and to the fears and concerns about how am I going to keep my lights on, my water on, and what's going to happen to me and my family. Those are understandable. And I just want everyone to know that we're working really hard. Me and my team, you can reach out to us. We are working remotely to help ensure the safety of the public as much as everyone. but we're going to keep working, and that's why we're going to keep getting information out. And I think we don't know. If I could give all of the answers right now, I would. But what I can say is, but what I can say is we're not going to stop fighting for the resources that are needed and doing everything we can to take care of our whole communities, because, we're in this together. And that's one thing Oklahomans know. And one thing that perhaps this is a powerful reminder of, that we have a whole lot more in common than we have that's different. Our fears and our challenges are really not that different from one another, even if we think they look different. But right now is a time for us to all do our parts, and we're going to keep fighting and I'm going to keep fighting to do my part to get the support into our communities that's needed, so that our first responders, the people that have to be out, get the support they need, the healthcare professionals, to make sure our food supply is continuing. These are the kind of things that we're working on, as well as making sure that, like we've done, making sure that people's water stays on and their power stays on. I was very glad to have the mayor's office announce that the water would stay on, because one of the chief recommendations, wash your hands, 20 seconds, soap and water. OG&E announced it was going to discontinue shutoffs of electricity, especially when we're social distancing. These things are so important, and so much more, but we're all in this together, and we're going to keep fighting. And please don't hesitate to reach out to my office. We are here to help, and we are working day in and day out for Oklahomans in the 5th District.
We'll leave it right there. Congresswoman Kendra Horn, please stay safe, healthy, and thank you again for your time.
Thank you so much. Have a good one. Thanks.